when you invest in one aspect of her life, um, as well as others, then there's a ripple effect. So, for example, when girls are more educated, and when they stay in when they're more educated, when they stay in school longer, and when they're safe from violence, the rates of child marriage drop. We see also rates of teenage pregnancy dropping, and this is an effect of having a multidimensional or holistic approach to how you invest in a girl. So again, we shouldn't just focus on one aspect of her life. We should focus on, when you look at a girl, different aspects of their lives.
Hello, I'm Françoise Girard, and today we're going to speak with Evalin Karijo about adolescent girls. Why it's very important to invest in the lives of adolescent girls if we want them to thrive. Secondly, what is the return on investment of that approach? And thirdly, why we need multi sectoral wraparound programs rather than standalone initiatives to improve the lives of girls. Looking forward to it. Hello, welcome to the Famous Podcast. Today I have the great pleasure of welcoming Evalin Karijo to this conversation. We're going to talk about young people, young girls especially. Evelyn is an award winning leader and she's the Associate Director, Policy, Partnership, and Engagement at the Girls Center, which is an innovation hub at the Population Council, the Hallowed Research Institute. The Girl Center envisions a gender equitable world where girls and boys make a healthy and safe transition into adulthood and reach their full potential. And in order to do that, the Girls Center commissions research and publishes it. Now, Evelyn drives the Girls Center's convening and thought leadership work. She also serves as the global co chair of the Coalition for Adolescent Girls, which is a network of over 80 organizations working with and for adolescent girls. She's focused on young people her entire career. And before the Pop Council, she was the director of youth and adolescent, the Youth and Adolescent Hub at AMREF Health Africa, and also the founding project director of YACT, an African regional policy advocacy initiative for youth. Evelyn grew up in Kenya. And what's very interesting to me is that she published her memoir, The Courage to Lead Young, in the early stages of her career to inspire young women, especially in Africa, to take up leadership roles also. She has a master's in public health from the University of Liverpool and an executive MBA from the United States International University Africa. And currently, she's pursuing her PhD at Indiana University. So, Evelyn, you are eminently qualified to talk to us today about young girls and young people. So, I'm very excited. And she was very kind because we met in September briefly. And before this conversation, she said to me, "So, are you also a youth?" And I thought, Evelyn, you've seen me. Maybe
You
I'm
are you at heart, for
yes,
sure, friend.
you're that hard. I'm certainly an old person at this point, but a young old person. So I'm thrilled to welcome you today on the podcast. And when we met in September in New York, it was around the opening of the General Assembly in New York City at the United Nations. You were presenting new research on adolescent girls that I found absolutely fascinating and that I really wanted to share with our listeners. You were participating at that point in a master class on the need to invest sexual and in the sexual and reproductive health and rights of young people to ensure that they not just survive but thrive. And I found that incredibly interesting. So, of course, I totally agree with you. We have to invest in sexual and reproductive health to ensure young people can thrive. But can you tell us uh, today why we need to pay attention specifically to girls? What are girls particularly vulnerable to? What kind of events and life circumstances are they really vulnerable to?
Well, thank you, Francois, first for hosting me on this incredible platform. And yes, we had such a great conversation in New York. And just as you've mentioned, as you are reading my bio, I'm very passionate about the well-being and leadership of adolescent girls and young women. I'm no longer a youth, but I'm one of those people who's made sure that we continue to invest in young women because I was there myself, and that's what inspired me to even write my memoir. And so, from the work that I've done, even beyond the council, we've always prioritized the well-being and advancement of adolescent girls. And just to give you a quick overview first about the council, we are an international research and thought leadership organization, and we work across different population and development issues. And when it comes to adolescents and specifically girls, we have reached over 30 countries for the past 3 decades, working with different partners, funders, policymakers, just to make sure that the evidence that we generate informs policies and programs. And so when people ask us why we focus on girls, I always say it's because the data and evidence tells us to. You can never go wrong with data. At the Girl Innovation Research and Learning Center, which is our innovation hub, we've always had an elevated focus on girls, not just because it's in our name, but because really evidence has consistently showed us that this is where there is the greatest need and opportunity. When you look at the adolescence phase, that is age 10 to 19, as defined by the World Health Organization, when you look at data, you realize that girls experience adolescence very differently from boys. Their vulnerabilities are unique, but also their potential is extraordinary. And I'll give you a few indicators that show the vulnerability of girls. Globally, 40% of girls are not in education, they're not in employment, and they're not in training, compared to only 10% of boys. I'll repeat that again, 40% of girls globally are not in education, not in employment, not in training, compared to only 10% of boys. And what does this mean? This means that their prospects for a more productive, healthier life, for better economic opportunities is diminished. And so for us, we have to take action based on this evidence to close this gender gap, of course, working with different partners. Another indicator around healthcare, 70% of all new HIV infections are among adolescent girls. Again, this really shows that girls are disproportionately affected when it comes to different issues. And these are not just numbers, they're signals of how gender inequality shows up early and stays, for life. So when we say we need to invest in girls, it because what happens to a girl in her adolescence often determines everything that follows, whether it's her education, her healthcare, her earning potential, and even her children's futures. And I know during the masterclass, we talked about why it's important to look at this data and acknowledge that girls experience adolescence differently than boys. And so girls are at the center of our work. For us, it's not just why we focus on girls, it's really being able to look at data and acknowledging their vulnerabilities and then taking action to inform different investments, policies, and programs that acknowledge these lived realities of girls and that meet girls where they are.
Yeah. And of course, boys have their issues. We're not saying that adolescent boys don't face issues, but what you're saying is that the situation of girls is remarkably different than what boys
Exactly.
experience. And if programs don't address those particular vulnerabilities of girls, if programs just assume there's a generic adolescent out there, they're not going to deal with the particular circumstances that girls face, right? Is that?
That's exactly what we're saying. And one of the things that we always encourage policymakers, programmers, and funders to understand that when we elevate the focus on one gender, we are not diminishing the other. I'll give a random example. If you and I, Francois, walk to a store and we need to buy something that's worth $10, I have $8. Francois, you have $5. We need to close that gap. All right. So if someone decides to give you $5 and gives me $2, that doesn't mean that we are diminishing your potential. It means that we are ensuring equity. So giving more where there is a gap so that both are at the same level. So we are not diminishing the needs and priorities of boys. We are looking at where the gap is. So we are looking at data and evidence that tells us there is a bigger gap when it comes to education, to healthcare, to economic opportunities for girls compared to boys. And then we fill that gap as different programs continue supporting boys. So whenever we say there's an elevated focus on girls, it doesn't mean that we are diminishing the needs and priorities of boys. We are acknowledging this variation, which is very evident in data across board, across all countries globally. So that's why we always say that every investment, every policy, every program has to be evidence-driven.
Right. And can we just, I think the figure of new HIV infections remains very shocking to me because that's been the case, I know, in sub Saharan Africa for practically the
A
whole
very long
duration
time.
of the epidemic. Yeah. It's still true. And the 70%, is that a global figure or is sub Saharan African figure, the 70% new
Um,
infections?
So when it comes to adolescents in different countries across sub-Saharan Africa and in many low and middle income countries, 70% of all new HIV infections among adolescents are experienced among girls.
Aha,
So
okay.
that's why we say the vulnerabilities for adolescent girls are much higher than that of adolescent boys.
I
Now,
see.
the issues around HIV are multifaceted, they're really multi-sectoral. You have to look at the different structural barriers, um, issues to do with early marriage, especially for girls, issues to do with teenage pregnancies. Of course, this is girls. When it comes to access to SRHR information, again, evidence shows us that girls are disproportionately missing out on critical SRHR information and not being able to take action. And that's why for most of, again, policies and programs, when it comes to budgeting, they have to be gender sensitive and ensure that adolescent girls are being elevated, again, not to diminish the other genders, but to make sure that we are able to close this gap and manage one, HIV in terms of prevention, ensuring that those who are affected are adhering to treatment, and of course, making sure that there's access to information.
Yeah. And when we say SRHR, we mean sexual and reproductive health and rights for those of our listeners
Yes.
who don't know the all the lingo of the field. And one of the things that is connected, I assume, to you mentioned early marriage, teenage pregnancy, but there's also violence against girls, right? Which, has, non-consensual sexual relations or coercive sexual relations with older men. I think that, right? It's still part of the pattern of HIV acquisition, right?
Oh, yes, it is. And usually we talk about the triple threat, ending the triple threat when it comes to adolescents, especially girls. So ending, preventing teenage pregnancies, preventing and managing HIV, and making sure that we, of course, those who are getting treatment adhere to that, and then preventing sexual and gender-based violence. Those are the three, unfortunately, issues that really affect adolescent girls, again, across board, across different countries. And thank you for clarifying. Yes, SRHR is sexual and reproductive health and rights.
Yeah. And one of the points you were making during the master class, which I thought was really important, you said, of course, we need, as you just noted, we need to ensure that girls can control their bodies and fertility. And so
Mhm.
we have to invest in sexual and reproductive health services like contraception to prevent pregnancy and so on. But we have to do more. We have to invest in a range of other sectors. And that's what you were describing as the multi sectoral approach to adolescent girls. Uh, can you tell us why that is so important?
Well, at the Girl Center, we like to look at girls as whole beings. And I'm sure you recall that I did give this example again at the master class. And we do note that the lives of girls are not just defined by a single issue. And not just girls, it's everybody, you and I. When we look at how we define our lives, it's not just about the work that we do or the incredible podcast that you have. It's not about the education and the DRPH that I'm doing. Our lives are defined by different facets of the things that we do on an everyday basis. And it's the same for girls. Their well being really depends on what happens to them in schools, in their homes, in their communities, whether they access healthcare. And it really means that girls don't live in silos. And so when we talk about a multidimensional approach, which again is one of the foundational approaches at the Girl Center, we mean that programmers and funders and policymakers need to connect all these dots that affect our girls' lives. So it's not just about providing one service. For example, it's not just about providing contraception. People and players have to make sure that that same girl is able to stay in school, that that same girl is safe from violence, that she can access life skills that will then position her to get economic opportunities. And of course, even looking at the community around her, this girl needs to be in a community where her voice and her leadership is valued. So when you look at different aspects of our life, we need to connect all these dots. The other thing that we see when you look at a girl's life is that when you invest in one aspect of her life, as well as others, then there's a ripple effect. So, for example, when girls are more educated, and when they stay in when they're more educated, when they stay in school longer, and when they're safe from violence, the rates of child marriage drop. We see also rates of teenage pregnancy dropping, and this is an effect of having a multidimensional or holistic approach to how you invest in a girl. So again, we shouldn't just focus on one aspect of her life. We should focus on, when you look at a girl, different aspects of their lives. And it's also about ensuring that systems around them work for them. So communities, decision makers, everyone has to rally behind ensuring that girls are thriving globally.
Mm. Are there examples that you've seen at the Population Council and at the Girl Center of certain countries or regions within countries where they've done that, that sort of wraparound holistic investment in girls?
Oh, yes. So the work that we do at the Girl Center is anchored around holistic investments and multidimensional investments. It's at the heart of what we do. One of the things is that we believe in investing in girls when it counts. And one of the programs that we are proud of, and you'll hear us talking about every other time, is the Adolescent Girls Initiative Kenya program, AGIK. We've implemented it alongside Population Council Kenya. So it's the Girl Center and Population Council Kenya. It's been implemented for over a decade. The program itself has reached thousands of girls, more than 6,000 girls aged 11 to 14 years. So the way the program is being implemented is that there are different interventions being tested. They're called packages of interventions, and they're layered. One of them is a cash transfer, which is conditioned on girls being enrolled in school. And this cash transfer is given to the households because of, the economic status in the regions where it's being implemented, the two counties where it's being implemented in Kenya. And then there's a community level component where the community leaders are involved in changing and shifting retrogressive norms and ensuring that girls are staying in school, that they're not being married off early, for example. And the third is around education and skills, life skills, financial education, so as to set up these girls for success. And the results of AGIK have been remarkable. Over the years, there's been reduced. First of all, there's been school retention, so girls are staying longer in school. Secondly, we've seen reduced cases of child marriage and reduced cases of teenage pregnancies. And what's really exciting about AGIK is that it wasn't just a pilot initiative. This is a model that worked, and the policymakers, the government leaders in one of the counties where it's being implemented, Wajir County, they've taken up this model and included the cash transfer component into their budgets. And so what that tells us is that we are moving from just generating evidence, but really using this evidence to inform policies and to make sure that it's sustainable for girls. For us, that's how the programs work, the multidimensional aspect, but also creating sustainable change that will continue being beneficial to girls beyond the program. Outside of Kenya, we also have quite a number of multi-country initiatives. At regional scale, we have an initiative that we implemented known as the Sahel Women's Empowerment and Demographic Dividend Project, and it's a long name. But this is an initiative that also had that multidimensional approach, reaching girls across 12 African countries. And there were aspects to do with education, economic empowerment, sexual and reproductive health and rights. But one of the exciting components of the SWED program is that it had a component of safe spaces where girls were working with their peers and teachers to make sure that they have access to the right information, to provide safe spaces where they can talk about their challenges and vulnerabilities and get that support, which then enabled them to stay longer in school and to complete school, and of course, protected them also from different harms, including sexual and gender-based violence. So they're protected against that through this sharing and getting access to support from their communities and teachers. I have to acknowledge that the SWED was being implemented not just by the Council, but by the World Bank and the UN as well, with the Population Council being a technical partner.
Ah, well, this is fantastic. So this work is really ongoing to really gather the evidence and test things out to see what works. But let's say I'm the Minister of Finance, of your country. They always want to know what is the return on investment. This is all fine, but it costs money, right? To do all that, the mentorship and the cash transfers and the community leaders, supporting the girls to stay in school. Uh, is there an economic case to be made for keeping, for investing in girls? What do you answer when they ask you that?
First of all, we acknowledge that policymakers, including finance ministers, have many competing priorities. And so what we tell them is that investing in girls is a smart investment, and the economic case is really clear. Evidence shows us that every dollar invested in an adolescent girl, it yields what we call a triple dividend for her, so for her well-being as a girl, for the next generation, and for stronger economies. And this is evidence from the World Bank, from UNICEF, and of course the evidence that we also generate at program level as the council. So evidence shows that it's a smart investment because when girls are more educated, when they're healthy, when they're skilled, they're able to contribute better to the workforce. They're able to also grow the consumer base because then they have stronger economic potential and they're able to drive economic growth. And looking specifically at countries, I know earlier you talked about sub-Saharan Africa. If you look at countries across Africa, where we have a large population of adolescents and young people, when countries and when countries are very intentional about investing in young people, then they're able to reap the benefits of this demographic dividend. The median age across many countries in Africa is 19. That's also an adolescent age. So when countries are very intentional about investing in adolescents from a young age, from when they're 10 to 19, and also investing in young people, there is potential to really harness and reap the benefits of investing in a young population, because they'll be better educated, they'll be healthier, they'll have better economic prospects. This drives the GDP, gross domestic product, and the economic growth of different countries. So it is a smart investment. And for ministers of finance, I usually, whenever we talk to policymakers, I always tell them to do the 3 Ps: to prioritize adolescents' holistic well-being, to protect their well-being, so ensuring that we have laws that are protecting them so that the gains are sustained from one, government or administration to the other. And then thirdly, to partner with adolescents and young people. They have to be involved whenever policies are being developed. They can't just be beneficiaries. They have to be involved as partners so that the policies and the budgets that are being made reflect their lived realities and their priorities. So the 3 Ps: prioritize, protect, and partner.
Yes, and we'll talk a little more about that participation. I have some questions on that. Uh, and are ministers of finance persuaded when you say those things and you present your evidence? Do they start to think, maybe that should be one of the focus of my administration?
Oh, yes, definitely. One of the gains that we've seen, and I'll give an example of the gains that we've seen even here in Kenya. One of the biggest benefits is the way the systems are structured. So nowadays, development in the new administration in Kenya is devolved. So we've seen local ministers of health and finance at some national level being able to allocate budgets specifically for sexual and reproductive health for adolescents, including making sure that health facilities are well equipped with health workers who can give services to adolescents, ensuring that they supply of products for adolescents, ensuring that their testing and counseling centers are working. What usually works when it comes to advocacy and really working with policymakers and finance ministers at any level, whether it's subnational or national level, is being able to align the needs of that particular population, so it's adolescents, with the priorities, the economic priorities of the country or the county. Those have to go hand in hand. And so we always present health also as an economic case, because it is. Health is a right, but also the more we advance the health and well-being of different populations, including adolescents and youth, we're able to advance the economic growth of a particular country.
Hmm. And so they're being persuaded, right? You're saying it's working. They're
We are,
they're
we are
starting to make
making
the
progress.
investments. That's good.
We are making progress for sure. And I know you've been seeing what's happening in the funding space. We are making progress. In fact, now the biggest hurdle that we have is not so much finance ministers, but also looking at the new governments or administrations that are coming on board in terms of how they prioritize gender, how they prioritize investments for girls. So we need to make sure that the policies and laws that are being enacted in one administration or government are carried forward even when that government transitions. And that's why the second P, protect, comes in. So it's beyond just getting one person to make that decision. It's about making sure that the gains are sustained from one administration to the other. I think that's where now the ecosystem is really having those tough conversations about sustaining gains that have been made, from one administration, and making sure that they're carried over to another.
Right. I mean, once we persuade one government, it doesn't mean that they stay persuaded, right? We have to keep on them. And
Exactly.
yes, yes. Um, getting back to the evidence of interventions, like what works better for girls, to ensure their well-being, are there interventions that are more, effective, if you had to choose where you're going to put your money, you would say, make sure to prioritize this one or that one, and things that don't really work, that maybe were popular at some point. There's various fads and fashions in our world also of, trying certain approaches for adolescents that turn out to not be that effective. Are there things uh, that you would say you don't, shouldn't be doing or spending money on?
Well, I'd say it's the approach that matters. And I know I've touched a bit on this. So when you look back at the multidimensional approach, what we've learned and what I've seen from experience, what works is when we make sure that we are focusing on different aspects of a girl's life. So for many programs that I've seen that focus on only one aspect, then you start having challenges, and even the girls themselves will tell you. So for example, if you're only giving access to contraception and not working with the government and players to make sure they're in school, when you sit down with girls, they're going to tell you, we want to go to school, we need to get education. So having that multidimensional and holistic investment perspective, that's definitely critical. The second one is making sure that we are using evidence to inform how we invest. And when you look at data and evidence, it will tell you that a one-size-fits-all approach doesn't work. What does this mean? It means that the investments that work for a girl in a particular region, say in the northern region, again, I'll use Kenya as an example, the northern region of Kenya may not work for a girl who is in an urban town in Kenya. I'll give quick examples on the issue of teenage pregnancies. The average rate of teenage pregnancies in Kenya is 15%. However, there are some counties that report up to 50% teenage pregnancy rates, which means 1 in every 2 girls. And there are counties that report as little as 8% teenage pregnancy rates. You'd say they're doing really well. But if you look at the national average, you might think Kenya is doing well. So if you think of a one-size-fits-all approach, you will miss the girl who is in that county that is reporting 50% teenage pregnancy rates, where for them it's 1 in every 2 girls. So a one-size-fits-all approach doesn't work. You have to use evidence to contextualize interventions. And so every time we are talking to policymakers and programmers and funders, we ask them to look beyond the aggregate, to look at what the data is really telling them, and then invest based on the needs and priorities of that adolescent girl. It's really about making sure that these interventions meet the girl where they are. So those are the approaches that work. One, making sure that it's multidimensional. Two, that it's contextualized, and of course, evidence-driven. The other practice that we've seen working really well, especially within our work at the council, is investing in girls when it counts. So one of the things that we also acknowledge is that the adolescent age band is not the same. So an adolescent who is 10 years old, their needs are very different from the one who's 18 years old and the one who's 19. So for example, if you're looking at aspects to do with sexual and reproductive health information, around puberty, a 10-year-old, a 11-year-old, an 18-year-old, yes, will still need this information. In addition to that, they'll need issues to do with life skills, economic empowerment skills, so that then they start thinking about transitioning to higher education, to the workforce, etc. So interventions have to be designed by age groups, 10 to 14, which is the very young adolescents. And this is where we are able to make the most change. 15, 17, of course, you add financial skills, continued schooling, and then in 18 to 19, and have interventions that also focus on livelihoods in addition to all other interventions around education and healthcare. So again, making sure that the interventions are based on the age of the adolescents.
Yeah, not some kind of generic approach that doesn't work at different age groups. As you know, I'm very keen on the participation of girls in all of these programs, and you just spoke about the need to really sit down with girls, because I mean, who knows better than girls themselves what they
Mm.
need and what they're facing in their daily lives. So that's something you're advocating, obviously, from what you're telling me. How can you give me some examples of how that participation by girls really has changed the programs, for the better, obviously?
Girls' participation is something that is mandatory. It's not optional for us and for different partners that we work with. Why? And I know you've mentioned this because they understand their needs, their priorities, but we also acknowledge that they are skilled, they are intelligent, they're not passive beneficiaries who should sit and just wait. So the first thing for us is always acknowledging that they are leaders by their own virtue, that they need to be heard, that their views need to be taken into consideration. And then the next is understanding that they understand and know their lived realities better than anyone else. So their participation, whether it's in research or programming or policy making, is mandatory. It's not optional. So every time we design programs, and I know I mentioned the SWED program, we always make sure that girls are included as leaders and as active participants of how the program is being implemented, of how research is being conducted. Within SWED, I think I mentioned this was one of the exciting pieces that we had safe spaces that were that went beyond just delivering information and support to girls. Girls were actually being mentored to be leaders and to provide peer support amongst themselves. So they become leaders in their own rights, their voices are heard. In addition to SWED, across the ecosystem, as a Girls Center, we co-convene quite a number of networks and movements. So currently, as the Girls Center, we are co-leading the Girls Deliver community. It's a community of over 80 organizations. And currently, we are developing a roadmap for change that is looking towards ensuring that girls' rights, their well-being is prioritized to 2030 and beyond. One of the things that we've deliberately done is to make sure that there is an adolescent girls working group. So we work with our partners to nominate girls aged 10 to 19 to ensure that they are able to participate as we develop this roadmap, and they've been leading sessions, sitting with us and giving us insights on what works and what doesn't work. And they even developed their own girls manifesto. One of the things that we have to always remember whenever we are involving girls and ensuring their participation is safeguarding. As an organization and as partners, we all have safeguarding rules and policies that ensure that the environment that we are creating and having for girls to participate as leaders is safe for them, that they are free from any harm or harassment within the environments where we're working. So we make sure that they're safeguarding. We ensure that they are respected just like any other person and that their voices are heard. So there's the technical bit, that's one, but there's also the leadership aspects and components that has to be valued and respected for girls' contribution to really be meaningful.
hmm Well, that's exciting. And I agree with you. It's not an add on girls' participation or an afterthought. It has to be built in, right, from the get go, from the beginning of the work, so that we don't go down, all these approaches that are not what they need because they know what they need.
Mm. Yeah.
Now, one last thought is the cuts we're facing right now in health, in education, in economic
Mm.
development, and foreign assistance. I mean, it's pretty dramatic. Of course, there's the US cuts, to USAID, by the Trump administration, but there's also, European donors cutting their investment in foreign assistance. So, how is that affecting the work you're doing? Are you worried about it? And what can we do to counter these cuts?
Well, this trend is worrying, and it's a very unfortunate trend. And I know we've talked about this a bit because the cuts that we are seeing right now in funding, whether it's in health, education, or gender equality, like we've witnessed this year from different governments and funders, it threatens to undo the progress that has been made for decades, all the gains that have been realized when it comes to ensuring that adolescent girls' well-being is elevated, ensuring that we are closing the gender gap. So, and I think this is the issue that we're talking about earlier, about sustaining and protecting the progress that has been made. So the funding cuts threaten to undo this progress. But we are also seeing an opportunity for us as partners in the space to learn. One is that we need to make a stronger case for why investing in girls is not optional, that it has to be mandatory and it has to be protected from one administration to the other or across the funders' ecosystem. The other thing is that we need to start having conversations, tough conversations around funding models and accountability. And I'll give you an example where recently, as the Girl Center, we co-hosted a donor roundtable within one of the coalitions, the Coalition for Adolescent Girls, which I co-chair and which is hosted at the Girl Center. We hosted a donor roundtable that had funders, grassroots organizations led by young women, data experts, programmers, and we had honest conversations around what's really happening in the funding space. Why are funders pulling away? Why are we not being held to account? Everybody, whether you're a funder programmer, why is nobody holding the other to account? Why are we not being accountable to the promises that we made to adolescent girls? So having these tough conversations is something that we all need to do and to acknowledge that there is a challenge. Two things stood out for me is one, whenever we talk about funding and the funding cuts, we have to make sure that it's not just about the numbers. We have to address that power dynamic and really know whose power are we elevating. It has to be the girls' power. So we need to honor and elevate the promises that we've made to them. The funding models must align to what we've committed with the girls to work on and support the organizations that work closest to them. And so organizations for a long time, and even during this discussion, we say that organizations that are working with girls and girls themselves need to have flexible long-term funding, which is not just about ticking boxes, but supporting capacity and supporting their core function so that they're able to continue sustainably beyond one funding model. The second bit that stood out is about the accountability model. And it was very exciting to see organizations that have come up with strong accountability models where they keep funders accountable. One of these organizations, which is one of our partners, is called We Trust Youth. It's hosted by the International Youth Alliance for Family Planning. They have great accountability models where they sit with funders, they sit with young people to look at the commitments that have been jointly made, to see who is keeping their commitments, both the funders and also the young people, because it's not just about receiving funds, it's being accountable to growing the ecosystem together. So accountability is the second thing that needs to be advanced in this space. So when you talk about funding cuts, one, we need to start having tough conversations on how to protect the gains that have been made across the different administrations. We need to talk about really honoring the promises that we have made to girls and elevating their power, and thirdly, accountability.
Hmm. Yeah, really raising our voices and being a little more maybe, I don't know if confrontational is the word, but a little clearer about what the implications are of the cuts, right? That
Yes,
it will affect the lives of girls, and it's breaking a promise for sure, uh, that we had made, that for the long term, right? So, well, thank you, Evelyn, for this. This is inspirational and also a little bit troubling, but I'm
kind of.
really excited about the work you've been doing, and being able to shine a light on it and let people know about it. So we're going to urge everyone to go to the Girls Center to look at your website and at all the evidence that's been gathered there. And there's lots of briefs and fact sheets and things that are really easily accessible so people can understand what kind of investments really work, and that's a huge contribution to the field. So I'm really grateful to you today for this conversation and for your leadership, and we'll do everything in our power to ensure that adolescent girls can thrive along with boys, of course, but especially adolescent girls, close to my heart. Thank
Thank you,
you.
Francois. We are excited, and yes, let's continue working,
Yes,
ensuring that no adolescent girl gets left behind.
that's right. A luta continua.
Luta
Luta
continua.
continua.
Expiro, expiro,